Here is another video in my journal of the brain surgery for Meniere's disease called Vestibular Nerve Section. I am updating you kind of on a day-to-day basis. Everybody's different and everybody heals differently.
Okay, here's Young Cook on Spotify.
Young Cook.
Hi, Spotify.
Hi, JK.
1, 2.
Love it how you love me electric, like you do. Love it how you love me electric, always you.
So I'm annoyed that I have these severe migraines because I have the opportunity to challenge my brain vestibularly so I can keep improving, and I can't do that. I already talked to my migraine specialist a week ago, and hopefully my insurance will cover the FIEPD, but we're still waiting. Having a migraine it's just so debilitating. A migraine hit actually as I was on the recumbent bike, and I had maybe 5-7 minutes to go. When I stopped and I started stretching, I was like, oh no. I couldn't even take a shower, just made it to the bed. Taking these medications and feeling like I'm just taking sugar pills. That was what it was like before my medication was working. I really want my future to be different. I really want to not be disabled. I really want to be able to work and to have a different life, and it just makes me feel like that's just a pipe dream. It's almost like the migraines were like, hello, I'm not gonna let you. Don't forget you're not normal. Even if you've had this brain surgery, you're not normal. I really want a different life than this. And I do everything that I can in my power to make it happen. And I do have a lot of things to be thankful for. It's been over 5 years now, but I will never forget how terrible it was to be disabled and shut in a room with windows that didn't let in very much light. Just a situation where, in hindsight, it felt like I was wasting my life away. And not because of the migraine. I was so unhappy. I'm just bored. It takes a lot to entertain me because I've seen so much. So many movies, so much TV.
For a minute in the quiet, it feels like it was before. I get lost just for a moment, thinking I'm not where I am. And I didn't want to feel this way.
Here we go. Oh. Oops. Shaking. Lately, my PTSD has been really bad. And it's just hard. So how I cope is to put on music, to blast it, and to dance. So that's what I'm going to do right now. So in the setting, just for the dogs, play D-Day by Augusty. Sometimes she doesn't get the word names right.
Okay, here's the album D2 on Spotify.
No, play D-Day.
D-Day by August D. Sure.
She'll play D2 by August D, but not D-Day when it is for it. Keep going. Keep going.
Tired of being out of place. Give me a one-way ticket out of here someplace. I know I can't be happy.
You just was on for 2 seconds and I feel better. Yes. Bring it over there. Good job, Penny. Good work. Look at that tug. You tug it. That's it. You got it. You got it. That's it. Easy. Good job. Well, I think we're bringing the table with us. Good job. Easy. Good job. You got it. Okay, easy. Easy. Wait. Uh-oh. Well, that's a problem. Give. Yes. What a good job. You get my cane? Yes. That's it. That's it, Benny. Give. Yes. What a good job. I'm so proud of you. Look at you navigating that well. Does it feel good? You needed your chin etched. Look at Mr. Pet Dog there, being respectful. He knows he's not supposed to come out even. Though Benny is. Good job, Dasher. Good job. Good work. Look at my puppies. You did such good work. Dashy did too. Grace. Wait. So we're at PT today. We got 4 more approved sessions from my insurance, so that is really awesome. I've been having really bad migraines, but I'm here anyway. There's something about this place that is so disorienting to me. I'm in this room. I come here before my session starts to get acclimated. When you have a migraine and your vestibular functioning isn't great here, I saw that very quickly and it looked like BTS. I mean, I guess you have to be Army too to see it that way, but I was like, oh wait, no. It's bits, not BTS. Oh well. Hello.
Go ahead and read me.
1, 2, 4, 5, 4, 3, 2.
Good. Back to you. Good. How you feeling?
All right.
Is that bothering you at all?
No.
That's great. Good. I'll say that's the hard part about replicating this.
This is what happens after a good physical therapy session. Vestibular pushed me. I actually fell into the car in the back seat when I was loading Benny. I mean, my mom had me. She was standing right there. She was like, had her hands on my back, so I'll be fine. I'll be okay. What basically happened is that in physical therapy, I was talking about how I've been going down to the ground when I'm doing specific things. And so we were trying to imitate that, what I'm doing that's kind of triggering that, so that we could practice it, so my brain could get practice and learn how to kind of function in that situation so that I don't keep going down to the ground. One of the things we did was when I'm filming and I look from the camera away to something, I'll go down. And it's not a big deal. Like, really, it isn't. I'm not hurting myself or anything. It just, I'm going down. When I got to the car, I was loading Benny in the back, and I was leading in, and I was taking his leash off of his collar, and whoosh, like, I just lost completely where I was in space, and I went completely into the car. And my mom was standing behind me, and she put her hands on my back, which actually helped me proprioception-wise, knowing where I am in space, to feel that, because part of balance is actually feeling. You feel through your feet, you touch things. I just stayed there for a while, and she was joking with me. She was like, well, I wanted to tell you, your jeans look really good on you. It's just what we do. Like, we don't act like, that's what I really appreciate about my parents, is like, they don't act like, oh my gosh, this is such a big deal. Like, when I, pass out or I have a vertigo so bad I fall down. Like, it's just part of life right now. And we just are getting through it. We don't make it into a big deal. We just live it and we move on. And we did. And, here I am, and life is good. It's a beautiful day here. It's so gorgeous. I don't know. It's hard to see, but the leaves are changing colors in town. They're just gorgeous colors, orange and gold and red. And I am tired. I'm going to go sleep because my brain is been so taxed by this vertigo that it's saying it needs a break. Good PT session. Hard, but good. I literally had the roller coaster of my life in the last 30 minutes. So because I'm getting hopefully Vyepti, which is IV, the pharmacist wanted to make sure that my migraine doctor was okay with me taking the IV cocktail, the medications that I've been taking already, the whole reason I got my port, and the Vyepti. And the nurse came back and said the doctor doesn't want her to take both. So they called me and they told me that. It was the scheduler that told me, not the pharmacist. The scheduler was in contact via text with the pharmacist. To have this treatment taken away from me when I'm doing so poorly, I said to her, this is not what we talked about at all. This doesn't make sense to me. I was completely shocked when she said it. Like, I was without words, actually, when she initially said it. And then I was just like, that's not at all what I thought. She called back and said, okay, you can get it this week. And she said to me, the nurse said that the doctor wasn't in. And I was thinking, after I got the phone, I was like, how can the nurse make the decision for the doctor and confirm that he doesn't want me to have these IV infusions when he's not there? And so I was going to write a message on my chart to them, but I've got an appointment in 12 minutes on telehealth, a therapy appointment. My PTSD has been severe for reasons I cannot talk about right now. I just had that vestibular therapy, which is really hard on me. And then to have this, my migraine treatment is going to be taken away when I'm literally every day I'm in bed. I have a migraine right now. It's not as severe as they have been, but it's been bad. I decided to eat because I didn't have a lot of time. And I was like, okay, I'm going to eat first and then I'll write the message and then I'll do therapy and then I'll sleep, which I haven't slept yet since vestibular therapy, physical therapy, which I really need to do because my brain is like, ugh. Meanwhile, I have a friend that's going through a lot right now, and she texted me, and I need to text her back. So I finished eating, and I was putting my dishes in the dishwasher, and I got a call from the scheduler again, and she said, the pharmacist and I talked about it, and based on everything you said, we thought it was kind of strange that they had decided to stop your IV cocktail. We called the nurse again, and the nurse apparently didn't even look at my chart. They just off the cuff said no. And when the nurse looked at my chart in depth, was like, oh yeah, she needs to get these infusions. The scheduler told me the pharmacist was so furious with the nurse. When the scheduler on the phone told me that I'd still be able to get this migraine cocktail IV infusions that I've been getting weekly for 2 years, I started to cry because it was like such a relief. I had been like feeling just so stressed about it. Did not need that in my day, but at least we know. It sounds like the Vyepti may not be. I thought that they had already gotten pre-approval for the Vyepti. Otherwise, why would we be scheduling it? I don't know. I don't know what's going on. I'm just relieved, but I'm really stressed. Like, it was stress I didn't need to go through. But I'm super thankful for the scheduler and for the pharmacist who believed me, who listened to what I was saying. Like, this doesn't make sense. I have a port. Like, this doesn't, because you only get Vyepti once every 3 months. Like, I don't need a port for something that's going to be 4 times a year. And it's not, we never talked about stopping it. Like, that makes no sense. The whole reason he's doing Vyepti is because I have a port, because I'm already getting IV infusions. Like, it never made sense. And I'm so thankful they double checked because they didn't have to. It was the nurse at my migraine specialist office that was the problem. How that nurse could do that and make a decision like that is not based on what a doctor is saying is ridiculous. And the nurse didn't, it wasn't like the nurse like had a conscience and looked at my chart and then called back. No, it was my hospital pharmacist that called them. I feel so thankful. I feel so thankful. Anyway, so I gotta go because now it's 8 minutes till my call and I'm a mess. My therapist is gonna get me in a big mess. I feel bad for him lately because there's just a lot going on with me. After I got off the phone with the scheduler, not the last time, so like the time that I thought that I was gonna have to call my doctor and be like, why are we canceling these IV infusions? I literally screamed. Nobody could hear me but my dogs, but I just screamed. Like, that's how upset I am, and I never scream. Life is stressful when you have chronic health issues. It's hard because you're gonna have to fight for yourself, you have to advocate for yourself, and you just don't always feel like it. Rarely do you feel like it, but I'm relieved that this has turned out. We'll see if the Vyepti gets covered. I'm hopeful. I am Kelly. Remember, you are not alone. Live incredible anyway. Bye, guys.
You are not alone in this world. You are not alone. You are not alone in this world. You are not